So in summary, what we had just discussed, the cardiovascular outcomes have been studied in many of the patients with both type 1 and type 2 diabetes. And here I listed the major cardiovascular trials that had been shown reduction in cardiovascular disease in advance and VA trial. So a core trial was stopped prematurely because patients actually with the very intensive control had increased risk of cardiovascular disease. So again, this is just to emphasize that we need to have kind of personalized approach to care of the patient. Some patients who may have already existing complications, as all patients in this study, in this trial, that a 3 trial that I had shown, which were enrolled already late in their disease and already had significant complications of diabetes. So initiation of the therapy late in the disease may not be as effective as when we initiate those early. So it is important to counsel our patient that we need to initiate therapy at the time of the diagnosis and prevent the complications. So intensive therapy from major trials could be reducing microvascular disease, some of the studies macrovascular disease, and again, only a cord trial showed increased mortality from intense treatment. The actual cause of that is still not known, but again, the patients were already enrolled in the study with the pre-existing very high risk for cardiovascular disease or existing cardiovascular disease. So in summary, there are genetic determinants of every patient for development of the complications, plus repeated acute changes in cellular metabolism, hyperglycemia, tissue damage, and leads to all the complications, plus accelerating factors, independent factors such as hypertension, hyperlipidemia, all determine the development of diabetes, of the complications. So for the manifestations of the diabetes, we know that prevention of complication is the key. You can see on that circle all the complications that can develop with diabetes. Diabetes death, 70,000 deaths in the United States attributed to diabetes annually. So we can definitely work on it to try to prevent it and to have early recognition and early treatment of complications. So summary points are that early prevention is the key. Education about the disease and complications should begin at the time of the diagnosis. Hemoglobin A1C reflects 3 months of blood sugar control. Hospitalization rate for heart attacks are higher among diabetics, and then in non-diabetics, the same thing with the stroke. Diabetes is the leading cause in kidney disease, accounting for 44% of all new cases of kidney disease diagnosed. Almost 4.5 million of Americans with diabetes age 40 or older have eye disease from diabetes. More than 60% of non-traumatic limb amputations in patients with diabetes, and 60 to 70% of people with diabetes may have mild forms or severe forms of the neuropathy.